press the button, that helps. Good evening, everybody. Welcome to today's meeting of the Health and Wellbeing Committee. This is a public meeting and members of the public and press are permitted to report on the proceedings. Reporting includes filming, photographing, making an audio recording and providing commentary on proceedings. Please note this meeting is recorded and streamed live. These recordings are published on the relevant meeting page of the Council's website. By choosing to attend this public meeting, you are deemed to have given your consent to being filmed or recorded and for any footage to be broadcast or published. If the alarm sounds, the premises must be evacuated immediately. Do not spend time collecting personal belongings. All emergency escape routes are clearly signed. Once you have left the building, the assembly point is in the High Street opposite the Guildhall. Members and other speakers are reminded to use their microphone when speaking. So first item is appointment of substitutes. Have we got any? No, everybody's here who should be, and I guess special welcome to Councillor Collier to her very first committee meeting. Any declarations of interest from anybody with regard to items on the agenda? Nope. Okay. Public participation? Nope. Okay. Minutes of the last meeting, which was 23rd of October. Are people happy for those to be approved and signed? Do you want me to go through? So page 1, happy with that. Page 2, page 3, page 4. Okay. We're in agreement, so I'll sign that copy and give it to Julian. So the first item then is public health update for Worcester City, and welcome to Matt Fung from Public Health.
Hello everyone, thanks for having me. I'm Matt Fung, consultant in public health from County Council. So I'm going to give you an update on the JSNA, the Joint Strategic Needs Assessment that Public Health do each year, and the slides are going to come up on the screen hopefully. Wonderful. So, if you want to just click on a slide, please. I'm going to take you through a mix of slides, really. Some of them are more county-focused, some of them are more district-focused. But by the end of this, you'll get an idea about the health and wellbeing state of Worcester City in the context of Worcestershire and England as a whole. This first slide here is just to outline the Joint Local Health and Wellbeing Strategy. So this is a strategy that's held by the Health and Wellbeing Board at County Council, and there were 3 focus points: healthy living at all ages, safe, thriving and healthy homes, communities and places, and quality local jobs and opportunities. And there's a bunch of progress that's taken place in the first year of the strategy around things like loneliness and work with kind of midwifery, on pregnant women smoking. There's a number of improvements been made in young people engaging in physical activity programs, things around alcohol provision and drug provision following release from prison, and a Healthy Schools grant. So there's a whole bunch of things happening, and that continues to make a lot of progress based around the strategy that we are kind of collectively working towards. Next slide, please. So the text is a bit small. I think you do have a copy of this that's been sent to you. So if you want to refer back to anything following the meeting, then it's all there. And also there's the full report, which I'll direct you to at the end. So as I say, there are a lot of good news stories coming out of the joint effort towards improving health and wellbeing across Worcestershire and Worcester City. As I mentioned, the drop in pregnant women smoking, that's a huge thing for us. We've always, since I've been around in Worcestershire, been higher than England average for pregnant women smoking, which obviously is not great start to life for that baby. So that's a really good picture that we're seeing there. Vaping and kind of illegal vapes being taken off the street, that's another success that we've seen this year. Bowel cancer screening uptake, again, I think I mentioned this one last year, and we've seen a rise in the uptake of bowel screening, which is absolutely fantastic. Worcester's Prevent programme, around extremism, we've been rated as strong, very good by the Home Office. I've mentioned physical activity in young people, and generally speaking, we have a good level of activity in our public health indicators that we track. So those that are better than England average and those that are better than the West Midlands within Worcestershire, that you're going to see now. So if you just want to click on to the next slide. So this slide here is all about comparing Worcestershire with the West Midlands around the public health outcomes framework. So a basket of indicators that we track to see how good health and wellbeing is across the county and across each district. So collectively in Worcestershire, we're number 1 in the West Midlands for health improvement outcomes, number 1 for wider determinants, 2nd across the West Midlands for health protection, so that's kind of infectious diseases and that type of thing, and 3rd for healthcare and premature mortality outcomes, so kind of early death indicators and that type of measurement really. So really very good when you compare us to the West Midlands. But you have to see that in the context of, we're really quite an affluent county in the context of quite a lot of the other bits of the West Midlands. So perhaps it's not such a good measure if you just look at it like that. Next slide, please. This slide, a lot of text on there again. But broadly speaking, the left column is Worcester City. And you can see all the districts really noted there. Where it's pink, purpley, whatever that colour is, magenta, I guess, that's where Worcester City or any of the districts are worse than England when you compare that district against England. So you can see quite easily where different bits of work still need to be done to improve that particular metric. So the ones that stand out for Worcester City are, the first one is around dementia diagnosis rate. So that's purely for the NHS. So not one that we need to worry about necessarily, but it's one to get to grips with from, are we diagnosing enough people? And that's suggesting that we're not, which suggests that more people than expected are living in the community without a diagnosis of dementia, which means that they may not get the right support or the right treatments that they need to live the best life that they can. We have some on alcohol-related admissions to hospital. There are some indicators worse than England on essentially child poverty still. So children living in low-income families, significantly more in Worcester City per head of population than in England. That's what that indicator is basically saying. We have more adults in Worcester City that are overweight or obese. There's something on loneliness. So we know that we have lonely people across the county, across Worcester City as well. But that is saying that we have relatively more per head of population than England. We've got something on emergency readmissions to hospital, which is a measure of lots of different things, and not necessarily something to worry about here, but it's something to be aware of. And then the final 5 at the bottom of the table are around cancer screening. So that's breast cancer and cervical cancer in 2 different age brackets, pupil absence, and mortality from cancer considered preventable, which arguably can tie back to those cancer screening metrics. So those are the things that flag as red or magenta compared with England. So it gives you some things to think about. You may think actually there's nothing that we can really do directly in a lot of these areas, but actually there is, because things like cancer screening, your role in that I see is kind of the promotion in your own communities, the circles that you mix in. For me, that is absolutely something that you can get involved in. And what we often see is this kind of inequalities gradient. So the more deprived the community, the less likely that they are to go for preventative treatments and intervention and screening. And that goes for ethnic groups as well. So what tends to happen is whether you look at vaccinations or screening or preventative health checks, non-white population groups tend not to go as frequently as white population groups. That's the picture, that's what the data tells us. Okay, so just on to the next slide, please. This slide is showing, again, it's just a cut of indicators by kind of how many, what percentage are better than England and about the same as England, etc. So it's just another view of the data that we've already seen. So that's just there for your information. So 21% of the FOF indicators in Worcester City are worse than England. 16% are better. Next slide, please. Okay, I just wanted to talk about mortality a little bit, so deaths, because I did mention this briefly last year, and this is really an update. The pattern and the picture arguably hasn't changed, and we continue to see elevations in the numbers of people dying, arguably prematurely, and of things that are probably preventable. So if you just want to click onto the next slide. So this is quite a clear chart in that it shows you, so this is for Worcestershire, it shows you by groupings of it. So 2015 to 2029 is the pink set of bars, so that's kind of combined mortality figures. Then you've got 2020 in blue, 2021 in purple, and then 2022 in turquoise. And on the left-hand side of each of the coloured bars are the most deprived groups. So the most deprived 20% would be the most left bar. On the right is the least deprived. Okay, so as you go along the years, you can see if you just track the most left bar of each of the colours, you can see that in 2022, you've got this elevation in the number of deaths in that particular group. And then the next 20% as well. So actually the far left two bars are increasing, which means that the most deprived people in Worcester City, well, this is Worcestershire, but I'll show you Worcester City in a sec, are dying at higher rates per head of population than they were pre-pandemic. Okay, that picture I showed last year, that picture continues this year, and although this is kind of annualized figures, so we don't have 2023 complete data yet, so but I can tell you that that picture hasn't gone away. It continues, and we need to be really aware of that and what's going on, because this is essentially what we need to prevent. And I should say this is for circulatory diseases, and it's what I've been flagging with the NHS now probably for the last few months, really, just to say we need to double down our efforts on making sure that people are attending their preventative appointments, like NHS health checks, leading as healthy a life as possible, not just thinking about losing weight if people are overweight, but finding the right interventions and services to help them do that, etc., etc., and the conversation goes on. So there are things happening, but this is just to report to this committee that for Worcestershire, this is what's happening, and that's for circulatory disease. If you just go on to the next slide, this is for Worcester City specifically. So rather than kind of grouping it all together, this is kind of separating it all out into district level data. Again, same time periods, but what you can see is that for Worcester City, that's highlighted in kind of the pink box, you can see that the bars are increasing, the different coloured bars are stepping up, and again, that is showing the same picture, not just by deprivation like we saw on the previous slide. This is for your whole population in Worcester City, and the risk of death is increasing arguably year on year since the pandemic. And as I say, for 2023, the picture hasn't gone away. So when I present back next year, when we have the 4 years data that's been analysed, we'll see a similar trend, but you'll see another bar that stacks higher than the previous one. So to me, this is one of our biggest risks in terms of health and well-being right now, cardiovascular disease. And I guess one of the tragic things about this is when I think about a road traffic accident, it's really tragic, and it hits the news. That's one person that may have died on the road. What we're talking about are hundreds of people just under the radar, though. So yes, it's not an acute, someone gets smashed by a bus or a car, but people are dying slowly, and it doesn't make the news because it's not. We must accept it as society, and I think we can do more about this type of thing. The interventions that exist. Next slide. So this is just a cut of different bits of data, really, just to outline some of the needs assessment. There's lots. I mean, there's lots and lots of slides that go into a lot of depth, and there's a huge amount of interesting stuff. So couldn't possibly cover it all today. But I will refer you back to the report, and you can have a look at the bits that are relevant to you. So you can see that this is just outlining some census data. We've had a slight increase in our population, 6.6% versus the previous census in 2011. Our older populations, the 65 plus, has increased dramatically, 27% since the previous census. And yeah, there's other bits around ethnicity and population mix there. Next slide, please. There are so many different ways that you can cut data and so many ways that you can present it depending on use case. This particular slide is just showing you one question out of hundreds, really, from the census that outlines the proportion of people in Worcester City and across Worcestershire that consider themselves in bad or very bad health. So around about 3.5% of people in Worcester City said that their health was bad or very bad, i.e. the worst categories, apart from death, really, on the census. So that's there, and you can see how Worcester benchmarks against England and the other districts. Next slide, please. And again, similar type of data, you can start to see how Worcester City benchmarks against disability nationally and in Worcestershire. So around about 17% of people consider themselves disabled in Worcester City. And again, that's kind of slightly kind of the higher end of Worcestershire there. Next slide. This one is migration and population churn in Worcestershire and Worcester City. I'm not going to go into this an awful lot, but the central point about this is we need to be looking at the people that we have in the city and adapting to changing need and changing population groups. And this is what this is saying, really. In Worcester City, there were 2,000, almost 3,000 national insurance number of applications in Worcester City in 21 to 23. We know that there's a fair amount of churn across Worcester City, probably the most churn in Worcester City compared with the districts, maybe apart from Wychavon with some of their seasonal working. But you can see that, as I say, that it gives a flavour of some of the changing populations in some of our areas in Worcester City, as well as the university as well. That brings in a huge number of new students every year, really. And what that does is it changes the profile of what people want or need in the city. And I can reference lots of different things, non-infectious diseases, infectious diseases, non-kind of traditional health matters that changes depending on where students are coming from in the world, what kind of baseline risks in terms of their health they're carrying with them into the city. And we need to be prepped for that because it's the reality of the context that we're living in. So that's that, really, just to demonstrate churn. Next slide. So this is section 5, and these are just some very quick overviews now. There's a whole section in the needs assessment around vaccinations, adult social care, safeguarding, resistance bands, falls, etc. So lots and lots in there. And we need to harness this type of information to target properly how we do future health promotion campaigns. How we get different groups to take up an offer of screening, for instance, or vaccination that they're not currently. And I'm going to talk about that in a bit because it's really, we need to really get under the skin of that. It's really important right now. Section 6. There's lots on children and young people. Again, we've covered some of this already, just around deprivation, around children achieving the best level of development that they can, given their circumstances. And we do have some entrenched problems here, particularly children in receipt of free school meals and their levels of development at given points in education. We constantly see people or children on free school meals not achieving nearly as well as they should and could do. So something is going wrong somewhere in terms of upbringing, parenting, and arguably the support that we're able to give in our school settings as well. Next slide, please. Wider determinants of health. I noted earlier that Worcester City actually was pretty good on this in terms of all of the wider determinants of health that we consider in the public health outcomes framework. But again, there's a lot in there: overcrowding, affordability, air pollution. We'll talk about that in a bit, deprivation, etc. So again, huge amounts in that section. Next slide. And I will just pick up air quality on this slide and at the end as well. So this slide is basically telling you how many of the deaths that occur in Worcester City are due to poor air quality, i.e. particulate matter in air that has significantly contributed to deaths of people. So that's 5.16% in Worcester City. And you can see how that benchmarks with other districts there. This is particularly relevant because many of you know that we're on the cusp of going live with all of our new real-time air quality monitoring sensors. That's going to be a fantastic resource that we need to leverage the data from so that we can not only record in real time, but offer arguably advice and intervention almost in real time as well. So I think it's going to be a huge capability that we need to leverage, not just in Worcester City, but at all tiers and all levels across Worcestershire. Next slide. Okay, this is a fairly pragmatic slide. What can be done? It's great looking at all the data, but it has to lead to somewhere, otherwise it's literally just data. So this is, I guess, my best effort at kind of pulling it all together and trying to, as I say, collate some actions that we can take from this. So we've got maximising prevention, promoting NHS services is the first one there. NHS screening, health checks, cardiovascular checks. Getting people who don't currently go for those types of things to go for them, that has to be one of our number one priorities. So yes, we have things like Your Health, Your Wellbeing, which are the vans. I've got a slide, a picture of that in a sec. But we need to get better at reaching those people who have always been termed hard to reach. They're not hard to reach for lots of different other services, but for whatever reason, we're not connecting with them in the way that they want to be connected with. So I think the service needs to change, and we are doing that, but there's still more work to be done there. Promote vaccinations, flu, COVID, MMR. Vaccination is literally a cornerstone of public health. We have to carry on with it. It gets boring, yes, I know. We banged the drum on it kind of all the way through COVID. But guess what? We constantly have like outbreaks, pandemics, and epidemics, etc. And as you know, at the moment, measles is the new kid on, well, it's not even the new kid on the block. It's like the re-emerging kid on the block. And again, it wouldn't surprise you if I told you the most common groups that the infections are taking place in are the most deprived children. That's where the infections are taking place. That's where the outbreaks are taking place. Those are the children at highest risk of significant complications of measles. It's not just a rash. It can cause long-term, irreversible damage, even death for some very unfortunate children and adults as well. So MMR is literally the way that we have to kind of continue to bang the drum on and promote as a system, because otherwise or just see our more deprived populations get measles and reap the consequences of that. Really important one. I've mentioned your healthy or well-being, which is a van that I'll talk about in a sec. So to do those things at the top, community development is absolutely needed. We need to address social isolation, which I mentioned earlier is one of the red indicators of Worcester City. To tackle the fundamental issue around health inequalities, I think it's about jobs and income inequality, actually. Income is one of the most sensitive ways in which people's health and well-being can be improved. It doesn't take a genius to recognise that if you don't have enough money, it's very difficult to live more healthily. If you have more resources, then you can choose how you want to live a lot more than if you don't have any money at all. And at the bottom, there's a load of stuff around health and planning. Kind of planning for healthy communities starts really here, like in the district, kind of with your plans and planning processes. So we feed into that from public health, but there's a huge amount of things that we can do there. Active and safe travel, promotion of air quality monitoring, warm and safe homes, cost of living support and benefit maximisation. To name but a few, I think is the caveat there, because this is not exhaustive. This is a bunch of things that I think would be reasonable to carry on doing. So yes, we've been doing a lot of them, but I think we need to do a lot more of them as well. Next slide, please. I just wanted to highlight this to you. This is our relatively new website. I can't remember whether I've brought this here before. Don't think I have. It's called Health and Wellbeing Insights. We set it up from Public Health. It has a load of different pages on there, but this is where we're really putting kind of good news stories about health and wellbeing. You can see the Worcester City kind of cut of the stories there, and you've got kind of the park run and celebrating success towards eliminating cervical cancer. That's on there as well. But really, we want to make this the hub of good news stories, and there's a huge amount on there. It would be nice to get some more Worcester City stuff on there, to be honest. So I'll talk to Lynn and others about that. If you click again. On Health and Wellbeing Insights, there's also a huge amount of interactive, pretty as up-to-date data as you can get. And you can cut this by Worcester City, by any district, by any ward, or by any level lower than the ward, which is LSOA. So you can go into there and really see whatever you want to on children's, adults, built environment, community, whatever, it's all on there. So that's what I'd really point you towards if you want to know more about the communities that you serve. Next slide. This is a photo op with, this is the Your Health, Your Wellbeing vans. Got two of these trundling around Worcestershire, doing lots of things. Health checks, vaccinations, cardiovascular checks, the stuff that I've just been talking about really. These teams are seeking to go out to engage with people that don't traditionally just go to their GP proactively, so that's what those are really there for. And finally, this is the last slide with a link to the JSNA and to Worcestershire Insights. That's the homepage there. But I will just reiterate, measles is probably the biggest threat right now to health and wellbeing in terms of infectious disease. We're doing everything that we can from public health to control outbreaks, to control cases. It requires everybody to push this amongst the communities and your circles of people that you engage with. Your own families, have your kids been vaccinated if you have kids or grandkids? Has your street been vaccinated? Have the communities, if you go to churches or mosques or whatever it is that you do, have people been vaccinated? Because measles is coming and it's coming quick. Birmingham is the epicenter. There's hundreds of cases in Birmingham. They're spreading to the west of the West Midlands and across the country as we speak. So I think my parting message is we need to double down on MMR vaccination, make sure people are vaccinated. So I'm going to end there. Thanks.
Thank you very much, Matt. There's a huge amount of information within that, and thank you for your expertise and sharing that. Open the floor to questions for Matt or observations. Neil?
Pretty obvious observations. Thank you for the really depressing and informative presentation. Now, I also appreciate your passion. It wasn't just hear the stats, have a discussion. I can see that you really feel what you're talking about. I really appreciate that. You know, it's a comment, not a question. I'll shut up shortly. But, you know, Worcester, the faithful city, very wealthy city, is what a lot of people outside of Worcester probably believe. And I certainly believe that, you know, as a tourist to Worcester. I'm not from Worcester. And yet, according to you know, comparison with national averages, we've got more children in absolute low income, more children in relative low income, and there are more adults who are obese than the national average. So truly shocked and appalled. I'm sure many other people would be as well. I suppose the question would be a very simple one. What should we do about those things? How can we redistribute wealth so people aren't suffering in terms of their health? There are items on the agenda later today, but they seem like sticking plasters, to be honest. You know, what is the long-term solution from a city council point of view to redistribute wealth so that there aren't so many people struggling financially and in terms of their own health?
It's a great question. Obviously, there is not one easy answer, otherwise it would have been done, and we wouldn't have vast amounts of income, wealth and health inequality, frankly, across the city and the county. The fact that you're surprised that there are those pockets, it doesn't surprise me, because what often happens is when we look at data nationally and even locally, we have a phenomenon which masks the average, or the average masks the inequality, I should say. And essentially, those communities absolutely exist. Kind of deprivation and poverty exists in every community. When you have such a wealthy place as Worcestershire and Worcester City, it's very easy to lose those communities and those people in the stats, because generally everybody's doing okay. Average wealth is okay, thanks very much. But you have to really dig into the data to start to recognise kind of what the issues are that face real people in the communities that we serve. In terms of redistributing wealth and all the rest of it, I think we can control what we can control. You know, we're not going to solve poverty entirely. We're not going to solve income inequality totally. But what we can do is help people to claim the benefits that they're entitled to, if they're indeed benefit claimants, to seek and get the opportunities that they're entitled to pick up things like healthy start vouchers from the NHS. There are things that we can do, and that's kind of on the benefit and income side. But then it's kind of education. Education is huge. You know, when children have poor educations and have poor life chances off the back of it, we just have vicious circles that repeat themselves, and that's what we see happen in every society, every population across the country. Really, we can be concerted about trying to break that cycle, but it requires a very concerted effort. It's not going to break itself. So a lot of things to think about. I think the key though is to do something rather than sitting back and going, oh, it's too much, can't do anything. I think just having a vision to do something, I think, is better than nothing at all.
Chair, thanks very much. Got to talk again about vaccines, because I mean, you've spoken, you know, and I'll get it, I'll get the message. And you've encouraged us, and I think quite rightly, to use our networks to get that message over, because we all want safe and healthy families across Worcester City. So that's a relatively, you know, in terms of us, there are formal and informal ways of doing this. But I just get the feeling, and it's been, you know, obviously as we're all hearing on a daily basis, that there's more that, you know, needs to be done on a much more formal basis. Ultimately, you know, families that are, you know, I mean, individual agency is quite important, you know, like, and I don't question the right ultimately of families to make their own choices, but at what point, in a sense, then the question is, are we comfortable that we push this as far as we can do in a sort of legislative way?
I think all we can do is push the message. Obviously, nobody can be made to have vaccination. All we can do is point the way to how you get vaccinated, and frankly, remove as many barriers as we can that may be there stopping people getting vaccinated in the first place. Unfortunately, with MMR, it was severely damaged, wasn't it? Let's be frank. 20 years ago, by the Andrew Wakefield scandal, and that was incredibly damaging to the vaccination campaign. Found to be totally fraudulent, no truth in it at all in those messages 20 years ago. But sadly, some of that remains. So some of that is kind of the reason why people aren't being vaccinated. There are lots of other reasons. For some of our Muslim communities, there are barriers to getting vaccinated, though many Muslims, arguably the majority, are fine with getting vaccinated. So, there are messages that we can push in different ways to different communities to say, actually, we can work through those barriers. But I think the point is that one message to everybody isn't going to cut it, and it isn't cutting it, because that's why we have, I think last time I counted, around about 500 kids in Worcestershire that aren't vaccinated currently, that are eligible by the age of 5, I should say, to caveat that. In answer to your question, I think we can continue to push it as much as we can. We continue to use things like Your Health, Your Wellbeing vans, continue to push the message. One of the things that I'm actually finding fairly effective in my thought process anyway, at least, is do you have any idea what the isolation period is if you're a contact of a confirmed case of measles? I don't know, it's a straw poll just for this committee. Any idea? So if you've got kids who are a contact of a confirmed case of measles, they're going to be told to stay away from their setting, i.e. their school, for 21 days. For me, that is the clincher. And that's the thing that we haven't quite got across to the public. 3 weeks at home away from school is a huge period of time. So if there was anything around informed decision-making, that would be it, to change people's minds. Because actually, people can make the decision, parents can. No, I'm not having my kid vaccinated, I don't want them to be. Okay, that's fine, but this is the consequence if they're in contact with a confirmed case. And that will be found out, and your kid will be sent home from school for 3 weeks. So for me, that's the message that we need to start to get across now.
Thank you very much. That presentation will give you an awful lot of food for thought. And yes, regarding Worcester, yes, people do think Worcester is a wealthy place, but actually Worcester never has been a particularly wealthy place. It was an industrial city. It had a lot of factories, businesses, where people were living in, low-wage jobs, living in substandard housing and that. And really, we're still very much the legacy of that. Some of those industries have gone, but we haven't necessarily replaced them with the same number of jobs and the quality of jobs. And it all really stems down to really poverty, ultimately. And unfortunately, poverty leads to these, lower life expectancies. I mean, I live in Warden Villages, and that's separated from, if you like, Gorse Hill and Old Warden by Tolladine Road. And you go across that road, and the life expectancy drops by 15 years. And I know that when I go to Cranham Drive to pick up a prescription from the chemist, and you can see there that the standard of health of the population there isn't as good. I mean, I know when my wife had her stroke, and I went into one of the 2 supermarkets around there, expecting to buy some fresh fruit and vegetables. I went in there. There were plenty of snacks. There were plenty of frozen convenient food and that sort of thing. And I think the big challenge we have to get is to get people to eat more healthily in that, and to do things in that particular sense. I think vaccination is absolute key. I know as a Rotarian, the Rotary organisation is an awful lot in terms of eradicating diseases like polio through vaccination, and there's about 2 or 3 countries left in the world where we do have that, so we can actually vaccinate yourself out of a particular problem. And yes, and yes, yeah, certainly, yeah, and the question would be, I think, what do you believe should be the number one focus of this city council in terms of helping these particular people?
The most deprived people who are out of work following the demise of industry.
Yeah.
I think we've probably covered off some of the same groups, because there's a lot of overlap, isn't there, between our most deprived children now, for instance, and people who are out of work because their industry has disappeared. I don't think there's necessarily a specific intervention there, except building skills that make people employable. To those children of more deprived families, offering internships and apprenticeships. This is a big anchoring institution. I don't know what your kind of corporate social responsibility things are like here. I'm sure they're great, but kind of offering those types of internships and opportunities is invaluable to children who otherwise would have very few opportunities. So I think directly, that's the type of thing that you can do, and probably encouraging businesses across the city to do the same. I think that's how you get the scale of effect, really.
Thank you, Chair. Thank you for a really interesting presentation. Just following on really from what Stephen just said and thinking about the hard to reach people. I'm just wondering, with regard to travelling communities, are they part of the hard to reach communities?
Yes.
And is there anything we can do to help to communicate with them?
I think for me, it's about taking every opportunity. So where you're going out to see and visit travelling communities and those types of sites, I think there are opportunities to promote messaging. It's right, you know, in travelling communities, Gypsy Roma communities, etc. COVID was an issue and is an issue. MMR has been an issue and is an issue. So I think there are probably opportunities to do more with promotion directly to those groups, not just through health, but through the work that you do as well.
Yeah, also, thank you for the presentation, it was very good. There's a couple of things I wanted to ask about. The first one was pupil absence, because that was one of the factors that we are below in. Is that pupil absence due to ill health, or is it due to wider factors? And do you have any suggestions of what can be done about pupil absence? Because obviously, you know, attendance leads to better results and therefore better outcomes, so it's generally something I worry about a lot. And the other thing was loneliness, because that's also one of the factors that we're below on. Have there been any successful programs so far? Have we seen any movement in this area so far?
Great, thanks for your questions. People absence, I think that's everything that you just mentioned. Obviously, ill health you can't do so much about, but kind of unauthorised absences you can, but doesn't so much of it come down to parenting and how invested parents are into their children. So there are parenting programs and that type of thing. Are the right people accessing parenting programs? I think probably not always, sometimes, but not always. So there are courses and interventions for parents that are motivated and engaged with that type of approach. But what we're talking about here, again, is probably, in a lot of circumstances, intergenerational problems with school and education. So again, what we're talking about is breaking vicious cycles rather than, you know, an isolated event for that child in that family. So there's quite a lot in there, actually. Loneliness, yeah, I mean, we have a kind of a fund open at the moment from Public Health around loneliness. So we will start to gather more and more case studies. So, yes, there are groups and case studies that we've collected to date that have shown benefit for, those communities of people that are engaged, but there's thousands of people that are lonely. I think, what was the last estimate for Worcester City? 4,000 people that are, it may not be that high, I think it is something like that though, around 4,000 people that are coded as being lonely on our NHS GP practice systems. So what's that, circa 4% of the population. So there's a big cohort. Arguably though, that will predominantly be older people. And when we talk about loneliness, actually it's every age that we need to think about, because there are lots of lonely younger people as well. It's just that they won't report to the GP in quite the same way, or they won't be picked up in quite the same way as an older person. So again, it's a multi-pronged approach that's needed to address loneliness and social isolation across Worcester City. Of the whole of Worcestershire though, this is probably the place that we have the best chance of solving it, more so than other districts, just because of the, how contained Worcester City is compared with more sprawling districts.
Thank you. Just an insightful and hopeful but depressing message all at the same time, I think, tonight. But I had drafted a tweet the other day about the measles message, because I've been reading that with quite alarm, and I was vaccinated as a child, but I still got measles, and I still to this day remember my mum telling my mum that I wanted to die because I felt so ill. And I spent weeks in an infectious disease isolation department of Irvine Hospital, and I was 8 years old, and I can still remember the clothes I was wearing when I was admitted to hospital. So I will be shouting that message loud and clear. But what I wanted to ask about really, and it's not in the report, but I've again been quite alarmed reading it in several health releases this week, is around the demand capacity problem with dealing with sexual health problems and sexually transmitted diseases, and that the demand is starting to far outstrip the capacity. Is that something that we're seeing here? Is this a problem that's coming down the road that we need to be prepared for, or have we not been affected by that as much as other areas in the country?
In terms of our sexual health services, they're busy, but I haven't had any reports on it kind of falling apart, if that makes sense. Obviously, the way in which we do sexual health these days is very different to years ago. I mean, a lot of it's moved online now in terms of online testing, which is what we have in Worcestershire. And we have our clinics that people can go to be treated. But we keep a close eye on sexual health. There are some concerning situations that we have dealt with in terms of sexual health, but I think it's okay at the moment.
Thank you, Chair. Thank you for the presentation. Lots of alarming statistics. A couple that kind of stuck out to me. One was the mortality associated with air quality being over 5%. So one in 20 deaths in Worcester, if I'm correct, is associated or caused by poor air quality. The other was I wanted to ask you about was this trend of increasing mortality from cardiovascular disease, which looked very alarming on those graphs post-pandemic, and obviously the much higher mortality amongst the most deprived 20%. Do you have any sense of what the factors are as to why that has got so much worse since the pandemic and within deprived communities?
Again, I think it's really complex. There's not just one reason for the patterns that we're seeing. Part of it is a cause and effect from the pandemic. So people not receiving preventative treatment as they would have done in normal times during, the pandemic period. So they may have, put off their appointments or not had that particular treatment or operation, which has led to a cumulative risk, which is now presenting itself as people dying in higher numbers than there were because of cardiovascular disease. Perhaps changing lifestyles, sedentary lifestyles. There's lots of things that are in there that could have contributed to cardiovascular death. COVID itself has an impact on the cardiovascular function, so kind of attacking heart muscle, essentially, and heart tissue, which could have an effect. Why it would be amongst the more deprived people than less deprived? Again, lots of reasons behind that. During the pandemic, again, we saw the brunt of consequences always borne by the most deprived people. So during the pandemic, you may have remembered that the most deprived cohorts, people, were being infected more with COVID, had less chance to isolate, less chance to kind of protect themselves because they couldn't just work from home. Maybe they had facing jobs or jobs in warehouses, etc. Had therefore high levels of complications of infection and higher rates of death. And that's kind of continued through. So early infection could be a cause of higher CVD. Lifestyle-related issues probably are a cause. The consequence of healthcare being severely disrupted during the peak of the pandemic, probably all mixed together into this picture that we're seeing now. But rather than just ending on a really depressing note, much of what we're seeing is preventable. So a lot of cardiovascular disease is preventable. Death, or disease and death really, is preventable given the right circumstances, i.e. taking care of yourself, seeking preventative interventions and services, and really taking that advice on board and implementing it. So it's not just kind of losing weight. I think that's really simplistic, but it is about eating healthily, exercising healthily, stopping smoking. Don't start vaping if you're not smoking already, and taking the interventions, the treatments, the drugs that your GP prescribes to you. I think there's lots that you can do. But again, it's kind of getting people to realise it's not inevitable because you're more deprived that you need to live an unhealthy lifestyle and die early because your uncles and aunts and your gran died early. It's not inevitable that you have to die early as well. And I think we need to get that message across because I think there is a sense of despair sometimes in communities. Like, oh, well, this is me. When actually there are plenty of things that can be done to reduce risk and help people live a better life for longer. And that's what all of the stuff that I've been presenting today is really all about.
Thank you very much. It's always a really good session when you come and talk to us, and it is kind of the facts about the health inequalities and the information about Worcester, and absolutely inspires what we do as a committee and as a council. And certainly, the information and the reports you've brought us into in the past is, why we've had the child poverty task and finish group, why we've looked at food poverty, and the rest of our agenda is about the things that we can do as a district council at our level to make a difference. So thank you. Thank you for inspiring us and depressing us for the rest of this year. Thank you. Absolutely, you do it very well. Thank you. So next we have Q3 performance report. Lloyd, you're going to do that? Which it does show actually the number of kind of projects and activities that are ongoing within the remit of this committee. So over to you.
Thank you, Chair. Chair, I won't take too long presenting this report. It's the usual format, Q3 performance report. Just in terms of the projects and actions, 3 out of the 4 are showing green, and David will present an update on the active travel project a little later on. The projects showing red are the recommendations from the Child Poverty Task and Finish Group report. Members will recall we bring a 6-monthly progress update on that particular topic. There's one recommendation that remains, and that's trying to look at food production from allotments. and we've deferred that report to the next committee cycle, so we'll hopefully bring an update on that one to March committee and let you know what the plan is. Just in terms of the key performance indicators, there are 3 reds, all the rest are green. Just to reassure members around the young people mental health support, that's a slightly misleading one. Because the project started slightly late, the reporting has moved on a quarter, but it's exactly where it needs to be. So quarter on quarter since it started, there are 40 families or 40 new families being worked with. And we get regular updates from on-site advocates who are leading that project. So I know that's working really well. In terms of the number of RUS sleepers engaged with outreach services, mainly due to some resource issues, our numbers have dropped around that one. But pleasing to note that the number of RUS sleepers transitioning into accommodation is up. So slightly yin and yang there. And then the last red one is the number of exercise by prescription referrals. The scheme we've been reporting on, that had to be stood down during the last quarter because of resource reallocation, funnily enough to vaccinations, both flu and COVID. And as of the next quarter, we'll start reporting on that one via the new voucher scheme, which we've recently updated members on as part of the Wednesday all members briefing. So happy for myself or Tom to take any questions, but I'll leave it there, Chair.
Chair, thanks very much. Good news about rough sleepers transitioning to accommodation. The question about outreach services is sort of, I guess, answered within this, but in terms of the measures are in place to address this for the next quarter, are we confident that's going to actually be the case, Lord?
Through you, Chair. Yeah, I mean, the outreach services are delivered by a third party, so an organisation within the city. They've had some staffing issues, people leave, so they've been going through the recruitment in January. So we're working closely with them, but we are confident that that will increase. But obviously that's something that we're in regular contact with.
Thank you, Chair. And thank you, Lloyd. I was going to ask a question, what is the one recommendation regarding the Child Poverty Task and Finish Group? You've just told us that the recommendation is about food production on allotments. I might be missing something here, but how are we going to encourage food production on allotments if, as a council, we're increasing allotment fees? Or is there going to be a group of people exempt from those fees so that they can grow the food for free? Or have I missed something there?
I'll stay away from the fee issue, Chair, because that's for a different committee. Just in terms of what the initial plan was, I think first of all, Councillor Lawrence, and what we were looking to do was probably to try and understand from existing allotment holders what level of food production was probably already underway, because we're led to believe that quite a lot of allotment holders don't only just produce food for themselves, they are actually sharing it, you know, wider, whether that be family, friends, schools, community groups. So I think first of all, it was trying to try and understand what that was, and then perhaps use that best practice, good examples, share that a bit more widely across remaining plot holders. But like I say, we'll bring something back to the next committee with a bit of a plan and sketch that out for members.
Can I just ask about the exercise on prescription, that it was suspended in Q3 due to redeployment of staff, but up to that point it wasn't recruiting particularly well. Are we confident that this is a viable project to pick back up in the form that it was originally launched in?
I think probably the reason why it's been relaunched is recognising the fact that numbers were starting to drop off, and I think in previous performance reports, some of the reasons for those low numbers were cited. There were certainly barriers. What I can do, rather than me try and sort of give you a poor attempt to try and answer your question, if I can get Alan New, who's our sort of lead officer in this one, to update members on that, perhaps as part of Wednesday members briefing, just to reassure. Yeah, that's probably the best way to do it.
Thank you.
it is one of the projects that is sort of a joint piece of work with the Worcester Primary Care Network, and I think perhaps motivation came from their side, and it was one of the first things. So yeah, potential. I think there's a learning curve, isn't there, about how joint working is best utilised. If I could just ask a question with regard to the rough sleeper outreach. I note that 3 new rough sleepers with no recourse to public funds. If you could explain now what help is allowed for those individuals, or how is it, what can we do, what can anybody do in that scenario?
Yeah, I mean, it is limited as to what the local authority is able to provide statutorily. There are a lot of organisations operating in the city, as you're probably all aware, that are able to provide help and support. But a lot of that is through the third sector as opposed to through statutory organisations. Adult social care have a role to play where an individual is destitute, and they can do a Care Act assessment to determine if they've got any care and support needs where interventions can be put into place. But each case will be treated on its merit, so it does depend. So without going into the details of the individual cases, but in terms of a Worcester City Council perspective, we will always try and provide advice and assistance, but practical support in accessing accommodation is often very limited.
Thank you very much for that understanding. Committee happy? Oh, Steve, sorry.
Sorry, Chair. Just one comment about leading on from the rough sleeper outreach services that people may not be aware of, and which may have an ongoing impact going forward. Is we're all saddened to see the closure of Farrier House GP surgery, but it hasn't really been widely reported that they were the homeless service for Worcester City. Those homeless people that were registered with them will also have to be redistributed to other practices, and obviously their expertise in that area is being lost.
Yeah, absolutely. And I've sort of fed that back personally, if you like, to NHS Herefordshire and Worcestershire. It's a real concern, and I don't know to what extent other GP practices will be able to accept those patients, and how whether those individuals will find them. So yes, it is a serious concern, and I guess from a housing perspective, have we got a role or a sort of watching brief within that scenario?
Yeah, I mean, we've been in contact and been speaking with the primary care network around the impact of that closure. So yeah, I know it's come quite out of the blue and will have an impact, particularly around individuals rough sleeping or very tenuous housing conditions. We know it's widely used. So yeah, we're in contact with the PCN around trying to mitigate any impact.
Thank you. So yeah, I mean, health of rough sleepers falls within the remit of this committee. So I think it is one for us to kind of keep an eye on, and maybe look at bringing a future report on. Thank you. So with that kind of caveat, are we happy to accept this performance report? Yeah. Thank you. So next we have setting the budget.
Thank you. This report follows the same process that we've adopted in the last few years in terms of setting the budget for next year. You'll recall that the draft budget for next year was taken to the Policy and Resources Committee just before Christmas, and this is the opportunity for members to both scrutinise, comment and make any suggestions in light of that report. There's two appendices that accompany this. The first is the summary of the Council's overall medium-term financial plan, which shows for next year, 24-25. At the moment, we're planning for a budget deficit of 452,000. That will need to be funded from reserves. And the other appendix is the capital programme for next year and the following years. That covers the full council capital programme, which will include any projects that are relevant to this committee. I'd also draw your attention to paragraph 3.3. The particular item in the revenue budget that's relevant to this committee is the discretionary wealth and support budget, often referred to as DWAS. As part of the council's savings plan to address the overall budget deficit, the budget for DWAS has been reduced by 30,000 from 119 to 89,000. As a measure to maintain the amount that can actually be spent, we'll then be replacing that reduction with an allocation from the Household Support Fund grant. So as long as that grant continues to be received, the amount available for DWAS will be maintained at the original 119,000. As I say, this is the opportunity for members to make any suggestions of any changes or additions they want to make to the overall budget. At that point, I think we're happy to take any questions.
Yes, thank you, Mark. Thank you, Chair. So, P&R Committee, Policy and Resources Committee meeting on the 6th of February. I really should know the answer to the question, but is this the last opportunity for the councillors in this room to make any proposals in terms of the budget? Because, for example, Green Group are meeting here tomorrow night, and if we had some wonderful ideas, would we then be able to pass them on, or would they have to be properly discussed in this committee for it then to go to P&R? That's the first question.
Through you, Chair. Members can always bring presentations to budget approvals at any stage during the year, but obviously we try to funnel them through this process to get them all done by February. So the final opportunity to bring those forward would be the Policy and Resources Committee itself on the 6th of February. So it doesn't have to come through the committee, it can come through one of the other committees if you prefer, or it can go straight to Policy and Resources. Okay.
Thank you very much. And second question, so as of today, dozens of members of Parliament, including 40 Conservative members of Parliament, have written to the Prime Minister to lobby for more council funding. The projection in terms of our funding is we're looking at a 1.4 million deficit in the next financial year. So are officers minded to join people in lobbying for more funding, or is that for the politicians to put forward a motion to urge this council to ask for more money? How would we go about joining those MPs in asking for more money for this council?
Through you, Chair. Well, take any number of opportunities for individual councillors to write directly to MPs. There has been a consultation on the settlement, which closed on Friday, I think, and we did formally submit a response to that, which I'm happy to circulate to members, and just call for additional funding should some become available. Past experience has been that is ineffective.
Well, firstly, thank you for doing that. Can I ask how much money you asked for, or a ballpark figure, given the deficits that we're looking at?
Through you, Chair. No, there's more a question of the principles behind the settlement and what approaches can be taken. So there's no specific figure there, Neil, no. But feel free, as I say, as individual councillors, to write to the Minister and others, make representations, that opportunity is still available.
Thank you, Chair. Just a question regarding the Household Support Fund. I understand that that's a grant that we receive. Is there any impact to any other services that we provide by taking money from that fund?
Yeah, so in previous years, we've distributed household support fund to 3 or 4 recipients. At the moment, there's no indication that we'll be receiving household support fund for 24-25. And so there's a paper on the agenda this evening regarding UK shared prosperity funding, and we would look to use that to provide those same recipients with funding, albeit at a lesser value.
And by recipients, that's organisations, but we've got a separate paper on it for consideration, and it, I mean, might as well say now that the Local Government Association, they've put lobbying in specifically around the Household Support Fund and continuation of that, as well as, yeah, there's different varieties of lobbying and feedback and pleas to government, that to central government, that local government and councils are not being adequately funded by the settlement so far as we know so far. Stephen?
Yes, I was going to ask the question that Councillor Murray was just about to actually make, because I think it's important that obviously this council has made a decision that this £30,000 is better spent in the discretionary welfare fund than is in a household support fund. And it's obviously an important service, this discretionary welfare fund, and it has helped a number of people, having sat on a number of briefings and that. But I think we just need to make ourselves aware that this is a decision that this council and this committee has chosen to take, and I do hope the discretionary welfare system does deliver what we want it to deliver.
Okay, well, we do have a report on the agenda as to exactly what the discretionary welfare assistance fund has delivered. And I think hopefully when we look at that report and the decision about use of the UK SPF, so we've got 2 papers on the agenda, and I hope that will give committee members the opportunity to indicate to our finance officers the importance of those items within the budget for this council. Any other questions or comments with regard to this committee? I mean, there are some sort of chunky items in the capital programme. Some of them are because we're holding finances for specific projects. The one that I kind of feel I don't know a great deal about is the hostile vehicle mitigation. That is an awful lot of money, and as to whether some of that, is all of that funding necessary, and could any of it be moved to other more needy places?
Thank you, Chair. The HMV capital spend relates to the Victorian Fair in particular, where we're obliged to put in measures to ensure safety and be sure that the fair itself isn't at risk from a terrorism attack, for example. Currently, we hire the equipment to be able to do that, and this proposal would mean that we would have our own measures in place and would no longer need to spend the money hiring it. And over time, it would more than pay for itself. The key point, stating the obvious, is to be sure that we're buying the right equipment so that it's durable and will serve the purpose long term.
So it's a business case awaited. Okay, thank you very much. Any other questions, comments? We accept the budget report and look forward to more meetings on budgets before the end of the financial year. Thank you. Moving on then, item 8, update on the active travel action plan. Over to you, David.
Thank you, Chair. Good evening. So the report on the Active Travel Action Plan is in some ways an addendum to the performance report that we received earlier on the agenda. And it's one of the twice yearly updates on progress on the Active Travel Plan. The plan, you recall, was approved by this committee back in June of 2023. And it includes actions both internal to the council and then also those that are external, where the council can influence either directly or indirectly transition to active travel by our employees, councillors, residents, visitors and others who work in the city. The appendix is the detailed action plan. The report just draws attention to a number of the actions. You will see there's a lot of green on this action plan. It reflects good progress in many areas, but also the length of the plan, as some of the actions are not yet commenced, but they remain green because they're still within the time frame. Internally, we've done a lot of work on continuing improvements to cycle facilities at staff at all of the sites, and seen some increase in usage there, particularly at the Guildhall, and also promoting ongoing schemes and initiatives such as the Cycle to Work scheme, which has seen additional take-up, sustainability and health in future transport, known as the SHIFT scheme. That's referred to at 4.21 of the report. Staff and councillors are able to log miles that they do through work and commuting, both cycling and walking, and that generates a small donation per kilometre that the council makes to the Mayor's charity. And you can see that isn't a huge amount, but actually a number of staff are starting to pick that up, and it's something we're wishing to promote more. And each month, participants will get an email which summarises their progress, their participation, and what they've generated as a donation to the Mayor's charity. 4.23, we've done some work around surveying of staff to gather data on travel patterns and usage. We had a really good response, actually, 134 responses. We've got some work to do with our operational workforce at the depot. This was an online survey which works really well for most of the office staff. We'll do some further work with our operational team. So it was a really good response. A couple of highlights really to pull out from that. As expected, business travel was reduced to a really low level since the pandemic. And actually there is very little business travel. Most of our business is within the city. The staff aren't travelling, so the amount of active travel is quite low because there isn't a lot of travel in the working day. The two main barriers for staff for active travel commuting are distance. Clearly that's not practical for some people, and confidence. So we're ongoing with work to address staff confidence and being able to cycle in particular. And we ran some bikeability courses last year, and we'll do some more of those when the weather picks up a little bit. Just to note that active travel is a popular mode of transport to the depot. Our Towns Fund active travel project has actually helped to resurface or hard surface the remainder of the canal towpath. So that now runs all the way up to Sixways, and a number of staff do use that regularly. And also staff use to commute between our two sites. Externally, more activities around encouragement. There's a number in there. We've been talking to schools, and thank you to members that have supported that, because local ward members are really key actually in being able to engage with schools and to try and promote the Mode Shift Stars scheme, which really promotes to students the benefits of active travel. The Sustainability Community Grants, which are run under Environment Committee, actually awarded £1,000 to Bike Worcester to help expand their bike bus scheme, which members will be familiar with, which has been very popular and I think continues to grow. Currently there's bike buses at 8 different primary schools across the city. We've been active through communications, particularly in setting up an Instagram page, a relatively new area for the council, particularly focused on sustainability, this one. And there's a number of initiatives there, national and local, which we've been promoting, including National Walking Month and Wild About Worcester Way. Current work is to develop a web page on the council's site that's dedicated to active travel, so particularly promoting opportunities for cycling and walking, cycle parking. We're developing a cycle parking map and also looking at bench locations to support walking. And something we'll be including in our new starter pack for staff as part of the recruitment process is a section that actually promotes active travel and ways to travel into work that don't involve motor vehicle. Community engagement and events. We've started now with the benefit of having an active travel officer to actually build that into our planning. So the Worcester Show in particular, there was a communication plan that built in ways to actively travel to the show and planning cycle parking to make sure that that was available and attractive for people. 4.4.8 refers to the local walking and cycling infrastructure plan, the LCWIP. Members will be aware that that falls under the County Council's responsibilities as the Transport Authority, but officers have been working very closely with colleagues at the County Council and their consultants, Jacobs, who are working on that. There was an initial stakeholder event in September of last year. There'll be more engagement with key stakeholders in the spring on emerging routes, and that definitely includes city councillors. I've spoken to county officers about that, with a full public consultation in the spring, and then the publication of the document towards the end of this year, this calendar year. What's probably the major piece of work that we're doing around active travel is the bike share scheme that is due to go live at the end of May. Members will be aware we've awarded a contract to Beryl to operate that scheme. Work's quite advanced in identifying potential locations of parking bays. I hope members saw the communication in their weekly bag around that. Very welcome to have any thoughts and input from members. And we will be holding a member engagement event in February. So I think from memory around the 19th. That should be coming out to you fairly soon if it hasn't done already. And look forward to meeting many members and talking about the scheme a bit further there. That's taking up a good proportion of the team's time and will continue to until this scheme's well established. And then a note at 5 that we talked at the committee when the plan was approved around a set of metrics to be developed to assess progress. You'll be aware there's an active travel steering group members of this committee sit on, which has been really useful in developing the plan and helping to guide progress. And it's identified a number of metrics that will be reported back through to the steering group, probably more detail than would be appropriate for the committee scorecard, but I'm sure the steering group will work with us to bring certain key things forward for the attention of members in the committee. Thank you, Chair. Happy to take questions.
Thank you very much. There's a lot going on and a lot of ground covered. Covered there by bike or by walking, sorry. Questions or observations? Stephen?
Yes, the bicycle rental scheme. First of all, I would say it's important that members do let Beryl and the project team know about potential locations for these. I was speaking to somebody when I was door knocking the other Saturday who had concerns about where the bikes were being parked, and I reassured them that they were being parked not in residential areas, but we would be using things like spare car parking spaces and things like that for that particular purpose. Therefore, it's very important that members let them know about that. But I know we were talking about having a visit to Hereford to see how their scheme is working and that. Will there be a visit to Hereford for the opportunity for members to actually see the actual scheme and see anything we can take from there that we can make sure we put into our scheme?
Certainly something that I did very early on in the process, caught the train to Hereford and picked up a bike from the station there. I'm sure that's something that we could arrange if members wanted to sort of contact me directly. I'm sure we could arrange a visit to Hereford. Or, of course, people are quite entitled to just take the trip and sign up to the app and select the bike there. But either way, be very happy to organise something.
Thank you, Chair. Thank you, David. I was pretty sceptical about the plan last June, I seem to recall, and I'm looking at this and I'm feeling a bit shy because there are lots of brilliant ideas here. A lot of them are about encouragement, about getting people to be more active, and a lot of them are about information, so making people aware of where they might walk, where they might cycle. So I just want to say thank you for all the brilliant ideas. Having said that, I think the most important one is arguably the local walking and cycling infrastructure plan, which obviously belongs to the county council. I think infrastructure is going to be the most important thing that changes people's means of travel. I tried to cycle around Worcester. I tried to go from St Clement's to St Stephen's to do my door knocking on a Saturday, and it's always a nightmare. I never enjoy it. And I know that if we had better infrastructure within Worcester, in tandem with all the information that we're providing and the encouragement, that infrastructure will encourage people to get on their bike or walk. So let's keep sticking to this plan. There are clear milestones, but let's also encourage the county council to try and maybe move their infrastructure plan along and not wait until December this year, but get it done even quicker, because people want to cycle, they want to walk, and they just find it very difficult because there's a lack of infrastructure.
I think we can all share your frustration with the county council, if I may be so bold, on a number of fronts. Any other questions? Katie?
Yeah, just a quick comment or question about the time frame, thinking about the bike hire in the summer, but also the updating the council website to have lots of information about active travel, which is brilliant. It would make sense, I think, to coordinate those two things before lots of people start picking up bikes and trying to travel around Worcester. Is there a plan that those two things will happily merge?
Yes, really good point. Yes, we'll need a source of information. There'll be a website for Beryl, which is their national website, but certainly we need to signpost really clearly for anybody that comes to our website inquiring about the bike share scheme.
I've got a couple of questions or information, if I may. Specifically actually about the travel to school section. I mean, it's good to see that there are now a number of bike buses running. Is the remit specifically for primary schools, or is there potential for going into high schools? That's kind of my first question.
Bike bus is something that we've supported. Is actually an initiative not of officers and not of the City Council of Bike Worcester. So I can't give you a definite answer to that question. I'd probably best to go and ask rather than try to offer an answer.
Okay, I didn't know how specific the grant was in terms of, it's a grant rather than a commission to deliver.
Yeah, if it helps, Chair, the grant was towards equipment that supported that, so I suspect that could be used at either. I think there's some high-vis vests and those sorts of things that might need to be bigger size for secondary schools, but should be transferable.
Thank you. I think, yeah, it's not necessarily the answer for all schools, so it is about finding the right location. The mode shift stars, the kind of level of sort of publicity and knowledge around that seems quite limited, and I actually kind of asked a question at the recent county council meeting, and apparently it falls within the remit of the Highways Development Management team rather than schools, or rather than public health, which I think possibly explains quite a bit, really. So I don't know that it has been communicated to schools, and if I understood the answer I was given correctly, that the trigger point from a highways development management point of view is if there's a planning application of some kind. So, I mean, well done to, you know, our officer, to Becky, for finding it, pursuing it and promoting it. But I think there's maybe, you know, a different conversation as to where we link to within the county council to actually take it forward, because we've still only got 2 schools signed up to the lowest level. Is that correct?
I'm not familiar with the exactly how many schools are in at the moment, but this action plan is very much that, around an action plan for the active travel officer. And I know she's tried really hard to contact schools who've got lots and lots of different priorities on their agenda. Perhaps a more strategic conversation would be one we could pick up as well.
Okay, so on that note, committee happy to note the content of this report, and I think, you know, well done to Becky and to yourself and the team for the level of progress and the amount of projects within it that is being managed, and we look forward to seeing more of Beryl. Thank you. Worcester City Discretionary Welfare Assistance Scheme. I think we've got Rosie sitting at the back, poised to tell us about all the wonderful things that you've been doing.
Good evening. So you may remember this time last year I attended committee to give an update report on the scheme at that point. It had just come over to the responsibility of the committee at that point. And at that committee, the recommendation was to undertake a review of the scheme in the light of the cost of living crisis and the increase in applications that we were seeing, to ensure that the scheme continued to meet need effectively and appropriately. So this report provides further details on the conduct of that review and the outcomes of it, and there's also a recommendation, as has been alluded to, due to the uncertainty around household support funding, that if additional changes are needed from April, that delegated authority is given to make those changes. So in terms of the budget, again, as has been alluded to this evening, there has been a saving put forward from the DWAS budget of around £30,000 from the base budget, which will be compensated for using the Household Support Fund. There is still a very healthy budget in the Discretionary Welfare Assistance Scheme currently, with the additional allocation of household support funding that we've had. And in addition, the one-off child poverty funding allocated by this committee for childhood essentials. If you look at the scheme performance information, so in section 4, you can see just how many applications and how many households we're assisting through the scheme, and the significant increase, unsurprisingly, given the cost of living crisis, that we've seen in the crisis element of the scheme in terms of food and energy vouchers, and in particular awards of energy vouchers. So a 349% increase for energy and 594% increase in demand for food vouchers as well. Which, again, as I say, in light of cost of living and the pressures that we're seeing on lots of other services and lots of other budgets, isn't surprising. As part of the review, we obviously looked at previous performance and budget spend, and table 4.3 and chart 4.2 hopefully makes clear that what we were trying to, one of the key things we were trying to achieve with the review was to rebalance the budget around proportionality to demand. So as I mentioned, crisis awards demand has increased significantly, but the vast majority of the budget, so around 80% for the core scheme, is spent on white goods, and obviously simply because goods cost a lot more money individually than those vouchers. But we wanted to rebalance that a little so that we could continue to meet the needs of foods and energy vouchers while still being able to provide essential household items. And again, as I mentioned, we've received a one-off amount of child poverty funding. One of the intentions with that funding was to work with organisations to identify a way of setting up a baby and child essentials, almost like a baby bank, child bank, like the food bank. And I have approached a number of different organisations in the city, and that work is ongoing. But in the meantime, we have been using that funding for individual awards of essential items. So as you can see, for children's beds and bedding, when people are entering permanent accommodation after a period of homelessness, and also significant numbers around warm winter clothing and school uniform for families as well. So in terms of the review then, so there were a number of different strands to the review. The first one being around a consultation exercise, which was earlier in the year, where we contacted all our referring agencies as well as other stakeholders in the city to ask their views on the existing scheme and what they'd like to see going forward. We also reviewed good practice in other schemes nationwide, particularly looking at the local government associations, good practice guidance on these sorts of schemes, and found that actually what we were already delivering the majority of those kind of good practice examples. We also mapped other sources of welfare assistance locally and nationally, because what we didn't want to do was duplicate effort and then leave gaps elsewhere. So in the appendix, which I won't go through, but you'll see that the response was overwhelmingly positive in terms of the organisations responding experience of the scheme, and the fact that Worcester has still a very generous scheme compared to a lot of other areas, particularly some neighbouring areas. And so fundamental changes to the principle of the scheme weren't felt to be necessary as a result of the review. But what we have done is try to rebalance the budget and to ensure that we can meet those crisis needs for energy and food vouchers in the context of increasingly rising costs. So table 5.1 summarises the changes that have been made. So looking at the old scheme compared to the new scheme, and this new scheme launched from the beginning of December last year, so it's been in place for just over a month now. So in terms of food vouchers, whereas previously the maximum amount that could be awarded was £30, and that was usually for families who would not be receiving any form of income for quite some considerable time. That's now been increased to a maximum of £70, and it's a more variable amount based on household size. So again, as part of the review, I visited the food bank and spoke to the volunteers there around how they, what values they assign to different food parcels for different household types. In terms of energy vouchers, previously under the core scheme, the maximum award was a £20 voucher, which increased with household support funding to £49. We're continuing that £49 award for families who are more likely to need to heat a larger home, and £40 for singles and couples. And for both of those crisis awards, people are entitled to apply for 3 awards in a rolling 12-month period, whereas previously they could apply for 4 of both of those awards. So now there's a maximum of 6 essentially for food and energy combined. In terms of, excuse me, white goods, again, main principles remaining the same, but what we have done is obviously bearing in mind the saving that we needed to achieve and to be able to put additional funding into crisis. was to slightly reduce the offer to singles and couple households, so still providing electric cooker and fridge freezer so that we can enable people to purchase food in bulk and do batch cooking, which is more affordable for people, helps them to budget. But we now aren't providing washing machines to singles and couples by default. We can still, again, in terms of the discretionary element of the scheme, we can still do so if needed, but that will make a significant saving for the scheme. And we're also continuing the other essential items category, which has been a really popular category, kind of a catch-all, depending on your household. What's essential for your household will be different for different households. So it could be around essential furniture if people are resettling, it could be around clothing, school uniform, household items and so on. So we're expanding that, again with the addition of the child poverty funding. And in order to be able to continue that and to make that budget saving, what we've done is partnered with the Charity Shop Gift Card organisation, which means that we can provide a significant proportion of those essential items as good quality second-hand items, whilst also supporting local charities in the city and local charity retailers. And the Charity Shop organisation itself is a social enterprise organisation which does reinvest its profits into charitable objectives. So the intention, as I said there, is rather than providing vouchers to buy new items, we can provide assistance to more households for the same amount of money. So in terms of the household support funding then, as mentioned, the picture is very uncertain. There is no indication that we will be receiving that from April 2024, and the new scheme has been predicated on the additional budget that we have received through that allocation. And so this new scheme would be at risk should we not receive that additional allocation, therefore recommending that committee delegates authority to make any necessary changes from April in order that we don't overspend on that budget and that we're able to continue it for the most essential needs. I think that's everything. Thank you.
Thank you very much. A really clear explanation of what we're delivering and just how important it is to people. Questions? Comments? Everybody? Steve?
Thank you, Chair. Just a comment, really. Just looking at the feedback and then the changes that have been made to the policy, you can. I think it's just a really good example of responding to needs and adapting the scheme, and I think that will go a long way to the scheme being more effective. Fingers crossed for the same amount of money, but if not, the initiatives that you put in place look excellent to me.
Yes, thank you. How confident are we that the household support funding will carry on beyond March? Have you had any indication at all? Because obviously, if we're confident, that means there's a lot less work for the chair and vice chair to think of plan A, B, or plan B, C, D. So how confident are we that it's going to carry on?
As we've mentioned a couple of times this evening, there's absolutely there's no indication at the moment that it will continue. There have been various appeals is the wrong word, but there's been various submissions to government around the importance of it, but to date officers have not received any notification or notice that it'll be coming.
Can't see any other hands up. Thank you to Rosie. This is a really good piece of work, and you've put a lot of work into talking to stakeholders, looking at our scheme, and actually to maximise the amount of help that we're able to give people within our limited funds. And I think, it's probably fair to say that some other agencies in the city or charities didn't didn't necessarily recognise that we have limited amounts of money. You know, we can't help everybody that needs help, but it's absolutely vital that there is this safety net for those people who are struggling with the cost of living, and you've done a brilliant piece of work here. So a plug, particularly for the charity shop gift card scheme. So to, you know, get other charities to sign up to that, and, you know, to get people to use it and support it in general terms, because it is quite an innovative way forward. And we are lucky in Worcester that we have actually a number of really good charity shops that is it's also part of the sort of recycle economy, and, you know, people not throwing things away but donating them to charity shops, which benefits the charity, and then others who are able to buy or get household items or clothes more cheaply. Thank you. So noting the contents of the report, the huge increase in emergency need, particularly around energy vouchers, and with the Vice Chair, we will meet and look at it again, depending on the budget position as we go forward. Thank you. So the last item we have, which is the last item we have this evening is UK Shared Prosperity Fund, final year allocation, community and place priority, which is kind of the mitigating around the household support fund. So who's talking this one through? Tom.
Thank you, Lynn. I'd like to say this is the answer to all our problems, but probably doesn't quite go that far, but hopefully some way at least. In September 2022, the Council was awarded just shy of £3 million for the UK Shared Prosperity Fund, and we were required to submit an investment plan that set out how that would be spent and what would be delivered as part of that allocation, which went to the Policy and Resources Committee later that year. The three priority areas for delivery of the UK SPF: community and place, supporting local business, and people and skills. So this year, it was the end of last year, a review of the UK SPF allocations was undertaken. A needs analysis was done to highlight the current need in relation to the people and skills and community and place priorities. And then on 6th of November last year, the PED committee, which is where ordinarily considers the allocations of the UK SPF funding, considered the needs analysis and agreed to reallocate £100,000 from the people and skills allocation to be transferred across to the community and place intervention. So as a result of the potential allocation of this funding, as I say, ordinarily it would have been discussed or agreed through the PED committee, but due to it surrounding community measures to reduce the cost of living, it's been referred to this committee, which has constitutional responsibility for this agenda. So section 3 of the report includes a summary of the DWP Household Support Fund and how that's previously been allocated. It's been integral to providing support and mitigating financial hardship for residents impacted by the cost of living. So it has been very much a crisis-driven source of funding. And as it stands, it's due to cease in March 2024. So the only confirmation we've had is that it's confirmed up until March 24, and still waiting for confirmation of what might happen beyond that. In the current financial year, we received an allocation of £337,000, which was an extension of the fund from the previous year, where we received a little more than that. And it has been allocated to provide crisis support essentially to the most vulnerable households in need. So in light of the certain uncertainty around the future of the Household Support Fund, it's recommended that the allocation of £100,000 from the UK SBF is utilised to support households impacted by the cost of living crisis. That's been set out in table 4.2 of the proposed allocation. So essentially, the proposal is to distribute the allocation of the UK SBF funding proportionately to the recipients of the Household Support Fund, albeit at a lower amount due to the lower figure of funding, by way of trying to mitigate some of the impacts of the Household Support Fund coming to an end should it cease. I'd like to just draw reference to the alternative recommendations that were considered. So through the Household Support Fund, we did expand the supermarket voucher offer that Worcestershire County Council provided for free school meal vouchers during school holidays. So we extended it to preschool children and those in college, which amounted to about £15 per week per child that were eligible, and over a 12-month period costs in the region of £78,000. So we recognise that that's been a really useful source of additional support for that cohort of people. The free school meals during school holidays provided by County Council was also funded from the Household Support Fund. So in the absence of the Household Support Fund continuing, I suppose there's no logic to providing that through our allocation of this funding for the preschool age and college age pupils. However, if the Household Support Fund does continue, then that would be a sort of high priority for us to consider, or if there's any alternative funding that we're able to identify. The other option considered was around trying to upstream some of the support, so looking at how we could better educate, inform and support people through money management, so trying to maximise households' income, try and tackle issues around debt, so that there was less reliance essentially on crisis support. So we got some figures and spoken to the systems advice of what that would look like and how that could be delivered. But again, due to the level of funding, I suppose, essentially that we've got through this additional allocation, over half of that allocation would be used for that worker. And given the potential loss of the Household Support Fund and the potential impacts that that may have, the recommendation is to distribute it for the crisis support. Happy to take any questions on.
I think I've said something about every item on the agenda. I apologise. Never done that before. Don't think so. Yeah. I just want to say thank you to all officers involved in this. I mean that, and it is very depressing to see that we're taking from one pot of money and put it in another pot of money, just to keep people on a base level. And I do hope that the MP for Worcester and Worcestershire MPs watch these council meetings and see how hard officers are working to divvy up different pots of money from the government just to keep people afloat. So it is very much a comment and not a question. You know, you deserve a lot of credit, but it's just sad that you're having to do this because this is meant to be about prosperity, not paying for the basics. You're taking from one pot of money to another. Councils should just be funded properly and people should have proper living wages and so on and so on. And yet here we are. So thank you very much. Let's hope that this isn't the long term and it's until change of government. Thank you.
Chair, thanks very much. I mean, I know Neil's comments are sincerely meant, and I get that. However, this is a significant piece of work. There's, both in this and in the previous item we discussed, a real desire to get value for every penny that we spend, essentially. And I think it is absolutely critical for those families who are, you know, at the, you know, impacted in this way, that we actually streamline what the services. I mean, clearly the point that's been made about money management is a valuable point. There's no question that, particularly, and I was glad to see references to debt, because many people are still in an appalling position when it comes to debt. And you know, they're dealing with some, in some cases, some quite unscrupulous people. And that kind of information should be absolutely key that we get over to people, because, you know, when we go back to the beginning of tonight, when we were discussing health and across the county, those sort of issues of people feeling confident about their lives and about how they manage their lives are absolutely critical to much of what we actually do here in this committee. So I'm not minimising that. I think it's absolutely vital, but I think I agree totally with the point that's been made in the paper, that it, you know, if it is spent directly on that, then there can only be an impact on money that then would not go to people who desperately need it. So overall, happy to support the recommendation.
Thank you, Chair. Just looking at the proposed allocation of the £100,000, the DWAS scheme includes food vouchers, and I had assumed that those were food bank vouchers. So, and then you've got a separate allocation for food bank vouchers. So, is there sort of some logic behind having sort of two lines for the same thing, or is it not the same thing?
They are different things. So the food bank is sort of open access; anybody can access that. The discretionary welfare assistance scheme is much broader. So although we do issue food vouchers, they aren't for the food bank. So they'll be for the supermarket or convenience shops when people need direct access to food. So quite frequently, if they've just gone into temporary accommodation, for instance, and then they may then be referred onto the food bank for ongoing support. The reason for the slightly larger allocation to the food bank is to try and offset some of the impacts of any reduction for free school meals during school holiday periods. So we recognise with that funding potentially going, there will probably be greater demand on the food bank, particularly during school holidays. So hence that sort of slightly larger allocation there.
Thank you. That's a useful explanation, and it is very much a concern. Tor?
Yeah, I just wanted to acknowledge what a difficult job it must be to not know whether the household support fund is coming and to try and decide where these cuts are going to come in. And it's difficult for me having to read this paper and also make these decisions. I think the decisions that you suggested are very good. However, if the household support fund does come in, then obviously the support for children outside of school times would be really useful, and the money management worker would also be very useful if it comes in.
Okay, thank you. So I think, just to be absolutely clear, as to exactly what this paper is and what the committee are being asked to agree to. So our colleagues on the Place and Economic Development Committee have agreed an allocation of 100k to this committee, specifically around community measures to reduce the cost of living. And the decision is an allocation as in paragraph 4.1, so that's money for discretionary welfare assistance scheme, money for the food bank and money for the spend to save, which is kind of emergency measures, isn't it, to prevent homelessness where people are struggling with rent and with so on. And to be absolutely clear, this is 100k and agreeing to that allocation and to mitigate potentially the loss of over 300k. So within, you know, within the levels of support for our citizens in Worcester, if there is no household support fund from April onwards, there will be a reduction of over 200k in how we can help people. So on that basis, people note the contents of the report and agree the allocation so far as we can within the existing funds. I'm seeing nods all round. Thank you. Thank you very much, everybody. I think it's also just, you know, when we are looking at challenged budgets within the council, it's worth noting this is discretionary welfare assistance, but I think, you know, by your decisions and support today, acknowledge just how important it is as a funding element within the council and the impact on our citizens and health and wellbeing. Thank you. I think that brings meeting to a close, and thank you really for your contributions.